This is really exciting to be here today because we just came from a 2-day symposium on gay men who have sex with men and bisexual and trans people. And some of the things we're discussing here are some of the pointers we came up from that symposium. One thing we looked at was how to engage young people and adolescents in our own programming, because we realized that there are issues around mental health, especially when you're coming out, alcohol and drug abuse, and which leads to homelessness, and in the process increases vulnerability of young people. We looked at differentiated care as one of the key areas, and we talked about age in the differentiated care process. There we were looking at how the young people and the old people are able to receive services, because remember, we work with a community that is considered criminalized. So out of that, I will tell you a bit about myself. When I was coming out, I came out I think when I was around 14 or something, when I was quite young, but as a gay man anyways. And at that point, we didn't have people to tell us about safe sex, how to engage in anal sex, because that's how we engage in sex, and how to make it safe and pleasurable. In the process, when I was having my fun time, the first time I came to test, I was 26. You can imagine that I've been engaging in sex at a young age. No one told me about HIV. So when I learned about HIV, I learned about HIV when I was 26 years old. And then I went for my first HIV test. When I went for the test, I went to Kenyatta Hospital. And my sister worked as a doctor on the 10th floor. So I went there and I was really scared. When I was tested, thank God it was negative. But I had made up my mind that if I tested positive, I would not allow myself to live as a gay man and being HIV positive, because that is another story. The challenging part of it, or the saddest part of it, is that when we went back to the streets, because we never had spaces to test. So when we went back to the streets to tell our friends to go and get tested, quite a number of them turned positive. Unfortunately, quite a number of them again have passed on. Some of them have passed on not because they didn't have that support network, it's just because they gave up, because they didn't have that structure to accommodate their needs. So one thing that we did, and this is why this organization was formed, ISHTA, as a peer-led program to bring information, to encourage our community members to come and test. The key pillar of our community organization was peer education. We used ourselves as peers to reach out to our members and tell them, you need to test for HIV. You need to know your status. The best thing is that we've been able to mitigate and at least address some of the challenges that our community members go through. We work in Nairobi. This is the map of Nairobi. So we work within this, it's 9 counties, I just mentioned a few, and we work within hotspots. These are places where our community, you could realize I keep on saying our community members because I relate with the gay community, they are my people. So those are spaces where our community members go and converge when they want to have services. And we go there for testing, we go there with information, we got tested. And if you felt like you really wanted to move into a support group, we told you by will, please, you can join a support group. And there people will talk about adherence, taking up medication. I've mentioned about peer educators as a pillar because some of them came up with innovative ideas. There were parties, there were fashion shows, there were coffee dates to encourage our members to come together. We have outreaches, and social media has now played a pivotal role in creating reach. Because right now, especially which is now a learning site, it is very nice. People have come from other countries to come and learn how we set up and how we reach our community members. Of course, we still have challenges because we're working in communities and settings that still do not accept homosexuality. So yes, there are criminalized laws that are quite negative for us, but we try and survive. I mean, we just held the first symposium in East Africa and in Kenya, which is a very huge step. Well,